Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director, providing you the update from Albany Medical Center on the coronavirus. Today is Tuesday, May 12th. Fred, we normally begin by numbers from the county. And if people recall, when we first started, we would talk about the number of COVID-19 cases in Albany County. And then eventually I started to expand out and I would talk about the 5 counties. I don't have the numbers yet today, but going forward, the numbers I report out will be from 8 counties. And they'll be the 8 counties represented in our Regional Economic Development Council. And so to remind everybody, that'll be Warren and Washington, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene.
Right.
Now, Fred, we speak every day to area hospitals, and we also speak to hospitals out in Fulton and Montgomery County as well.
That's right, Dennis.
And when we talk about care being delivered in this region, it's important for us to talk about those hospitals as well. But we're going to talk about the number of COVID-19 cases and admissions and deaths in those 8 counties I listed, because that's how we've been defined as a region by the state.
That's right, Dennis, for opening of businesses.
And opening businesses. And Fulton and Montgomery are in Mohawk. That's the region that they're listed in.
Right, the western region.
Yeah, and they were allowed to turn on their areas, Tier 1. When we talk about the capital region, we're not turned on yet from a business standpoint, and the numbers we talk about will inform that decision.
That's right.
Okay, very good. So tomorrow when I give the number of COVID-19 cases in the counties, it'll be in those 8 counties. Inside here in the medical center today, 53 cases, 38 on the floor, 15 in the ICU, and 9 on ventilators, and I believe we still don't have any children in the hospital.
That's right, no
as
children.
of today. We hit a high water mark and a threshold number on convalescent plasma, a really good number to celebrate. So Fred, what's the number?
The number's 50, Dennis. We have transfused 50 patients with convalescent plasma. Just tremendous effort on the part of our blood bank, the American Red Cross, the folks in the ICUs, both the nurses and docs. Everyone's done a terrific job.
And the incredible community that came forward and actually consented to and agreed to donate their plasma.
Right.
Many of the patients who've gotten convalescent plasma were on ventilators and are now off ventilators.
That's right.
And so we believe that that has helped contribute to part of their healing. So hopefully we'll report out a number 100 in a couple weeks.
Yes.
I think we will. Speaking of the great work of the lab, a lot of discussion about antibody testing. We want to provide an update. There are 2 different groups that we're talking about antibody testing in. Let's address first and foremost our workforce. Fred, you mentioned there was a study going through our IRB, which is our research board, about this. What is the update on that?
So Dennis, the study is going to look at 3 categories of employees. The first category, we're kind of going to be the controls. So people who've worked for us who've not been tested and there's no indication that they've had COVID.
So that could be you or me, for
That's
example.
Right. Yep. As a matter of fact, we could be.
Yep.
Then the second group will be those employees that had symptoms and tested positive. So we want to see what their antibody response was. And then the third group, which is probably the most interesting group to me, is those employees that had symptoms that tested negative. So we want to see what their antibody response might look like. If those symptoms had nothing to do with COVID, their numbers should be the same as the controls. But if some of those symptoms really were COVID and the test had a false negative, then perhaps they would have a higher incidence of antibodies.
So as you would expect, there's a lot of members of our workforce who have heard us talk about this, who have emailed you, they've emailed me, they've said, how do I find out more about this? I believe we'll have some more information on our intranet page in the next couple days.
That's right. We're going to look for volunteers, and we're assuming that there'll be many more volunteers than we're going to test, and so there'll be a random selection from there.
There's another group of people who are interested in antibody testing, and that would be the members of the community who are not part of our workforce. And I believe, Fred, we may have some more information about that in the next couple days as well.
So some of our clinical folks in the EPI group are working on indications for testing, clinical testing. The indications, I think, are going to be relatively small. It's not going to be a huge list, but we'll hear more about that. We should have a decision in a day or so.
And those criteria could be the type of work that they do and or whether or not they have certain underlying medical conditions?
Sure. Immunocompromised patients, first responders, the children who perhaps have had this syndrome that the state's very interested in, the DOH is very interested in, would be a category as well.
And in the future, as testing becomes more readily available, then the criteria would expand. But in the beginning, we'll keep it narrowed to a particular group that is the most necessary to test.
The amount of testing that we're going to be able to do in the beginning is not going to be as large as we might like, so we need to be a little bit careful.
Yesterday we spoke a lot about safety, safety not only in the hospital, safety in the practice, safety in our operating rooms. We mentioned that we were restarting medically necessary procedures at the South Clinical Campus. Fred, I know today you had a long discussion with our environmental services leadership to talk about what we are doing specifically to make the environment as clean as possible.
That's right, Dennis. I talked with Tom Bucci, who's one of the managers in EVS, and I asked Tom to walk me through all of the things that we've been doing to make the environment safe, both for patients and our staff. So Tom started by saying that the census in the hospital, by being lower, has freed up a number of his folks. So they've been redeployed in teams, what he's calling cleaning teams.
Cleaning teams.
And so they own a building. So the A building, which we're close to, they start in the basement. They clean all the high-touch surfaces, handrails, doorknobs, countertops. They work their way up to the 4th floor, and then they go back to the basement and start over. They clean the bathrooms. They clean the waiting rooms. And this is, when I say clean, they're wiping things down with a disinfectant wipe. Okay. So that's something that I think is very important. On the nursing units, there are PCAs and other EVS folks essentially doing the same thing. So all the flat surfaces, all the high-touch surfaces, telephones, computer screens, keyboards, again, wiping them down with that disinfectant material or wipes to eliminate the virus. The patient rooms are cleaned in our usual fashion, but then in those rooms where there have been COVID patients, we're actually using TrueD, that ultraviolet system that we've talked about, to really eliminate any trace that there might still be of viruses. And then the third area we talked about are our operating rooms. So as you know, Dennis, we started doing electives at South Clinical again. So those rooms are being cleaned with an interesting product called Oxycide.
Oxycide, that has the hydrogen peroxide in it.
Hydrogen peroxide, that's right, and peracetic acid. So when you walk in the room, it smells like vinegar.
And they say vinegar is the new smell of clean.
That's right. Vinegar is the new smell of clean. So they're using that to clean the rooms, and they use that between every case. Then at the end of the day, they do something called a terminal clean, where literally they start with the ceilings. They wipe the ceilings down. I asked Tom how they do that, and he talked about a telescopic thing. Then they wipe the walls down, all the flat surfaces, everything, the floor on their way out. Takes them about 40 minutes. So really, really good deep cleaning. And they also use TrueD in the operating rooms. So just an enormous effort on the part of our EVS folks. They're doing a tremendous job, and they're doing that to make you safe, our staff, and our patients.
Well, thank you for talking to Tom. Thank you to Tom. Thank you to his team. We've always been very grateful for the great work they do inside here, but no so more than today. And
making a huge difference for us.
Couple of nice things today, Fred. We had a parade today. This was on one of the cars here. Another group led by, I think, the Albany Police who came through. So we want to thank the Friendship Circle and the Chabad of the Capital District who came through and showed their appreciation to our workforce, and we very much appreciate them coming by. I know some people appreciated that, came out and took a look at the parade. And while I'm speaking, I think we'll be looking at some video from the 109th Airlift Wing by the New York Air National Guard, who did a flyover of area hospitals. It was a way to show thanks not only to healthcare workers and first responders, but all essential employees. And we were so appreciative. I got a chance to go outside, actually, and take a look at it. It was quite a sight.
Pretty low.
Yeah. And in particular, I'd like to thank Jason White and David Gardner, who are actually in this room helping us do these videos every day, who were able to get some great footage of the planes as they flew overhead. Lastly, if you are an employee, we encourage you to go to our intranet site. There is a lot of information specifically related to COVID-19. In fact, we've also listed not only policies and procedures, all of our videos, but as we mentioned, there's some good news stories in there. And if you'd like to submit some, we can post them there as well. You can send it to albanymedcommunications@amc.edu. In addition, if you're the public out on the outside and would like to take a look at our videos, we encourage you to come in at amc.edu. But this is two great resources, both inside and outside the organization.
Absolutely.
Very good. Okay, so more on safety tomorrow, more on regional data tomorrow. Like I said, we have been speaking to the leaders of the Regional Economic Development Council, trying to understand the data set on the reopening of the businesses. We hope to have some more information tomorrow.
Yes.
Okay. That'll do it. We'll be back again tomorrow. Once again, we ask that you please take care of yourself, take care of each other, and we will see you tomorrow.